Daeylin Rock is our next presenter, and Daylin's going to go ahead and tell his background and get us started. So thank you, Daeylin.
Thank you. Wow. Okay. Hi, everybody. That was a lovely greeting. Thank you for saying hi back. Usually people don't when I present. Can everybody hear me okay? I don't always love these, but oh, wow. When I go like this, it's much louder. Wow. Okay. This is great. So welcome. Thank you all so much for choosing to spend a little bit of your afternoon today with me. I was talking about something that I feel really, really excited and passionate about in particular, because I'm a therapist, right? And so that's what we're going to do today is talk a little bit about mental health. And I know that the last year and a half, 2 years, 3 years in particular, post-COVID, this has become a much more, I think, acceptable topic for folks to bring up. And one of the very, very few good things to come away from COVID was a growing awareness about the challenges that folks face in mental health. So it's something that's deeply personal to me. Like Willie gave his introduction, my name is Daeylin Rock. I am a licensed professional clinical counseling supervisor. It's a mouthful in the state of Ohio. So that means that I spend, when I'm not doing things like this and spending time with you fine folks, I do counseling, right? So I actually sit with humans like yourselves in a one-on-one in a lovely office setting. I make them lay down on the couch. No, that's not a thing that we do. Actually, don't listen to TV. It doesn't look like that if you haven't seen a therapist before. But I do counseling. I sit with folks who are struggling each and every day with things that we all go through, things like stress and depression and anxiety and family troubles and couples work and all of it. And the other thing that's really important to me in my work is that I've spent my entire career in employee wellness, in particular working for a company called Matrix Psychological Services, where I'm the vice president of clinical services. And so we do a lot of really cool things, but I have the unique opportunity to grow my entire career working with companies, working with organizations to help foster the development of mental health in their organizations, right? Helping employees feel empowered to seek out mental health services, and in particular, help folks feel more connected to talking about something that I think is really for a long time been a challenge. So I'm really excited to be here with you guys today because when I have these conversations, usually I find that I'm not alone in feeling passionate about this kind of thing. Also, I'll apologize in advance. I walk around a lot. I can't stand still. It's a problem. I don't have ADHD that I think, right? My wife seems to think I do sometimes, but alas, that diagnosis has eluded me. So I'm going to be all over the place, guys, if that's okay. Hi, down here. So why we're here today is really important. Mental health in the workplace. This is something that, for those of you, I think we're in the HR track today, right? Yes, HR stuff and all kinds of HR things. I talk with a lot of HR folks each and every day. Sometimes it's as my role as a therapist. Sometimes it is in my administrative role within Matrix, but I spend a lot of time doing consulting with HR. And you guys, for those of you who are specifically in that role, I have to admit, are probably the therapists of the business world, right? You guys hear stuff, you hear challenging things each and every day. And so I'd like to think that you guys are doing a lot of what I do each and every day, probably without realizing it. So I want to start off with something that is maybe a little bit candid. Let's see if the clicker works. Click. Yay. Well, I don't know if my clicker worked, but I can just say the word. Let's talk about mental health for a second. So I'm a therapist. I've mentioned that already. Let's start off by sort of saying what I would say to a lot of my clients when they first come in to meet with me for the very first time. I usually say something like, it's really important that we see this space as a protected, really private space. Counseling is 100% confidential. I'm not allowed to share anything that any of my clients share with me outside of the counseling office. So let's pretend for a moment that this lovely room that we're in is like a counseling space. And everything that we share together today, everything that we talk about together today is protected private information, right? We're not all going to go out and say, okay, well, if somebody shared something intimate, we're going to consider this a confidential space. Deal? Can we agree to that? Yes? Confidential, private, wonderful. So I'd like to start off by asking all of you a wonderful question, series of questions. And you don't have to participate in this if you don't want to, but just first of all, by a show of hands, how many of you have ever experienced stress? It's a dumb question, right, Daeylin? Yes. Yeah, so probably all of us. How many of you have ever experienced worry? Yeah. How many of you have ever felt like you low-key wanted to poison your partner? Yeah, don't be shy. Come on, we've all been there. How many of you are cat people? That is a surprisingly low number. How many of you are dog people? Ooh, okay. One of those was correct. One of those two was correct. I am a cat person. Yes, yes. So for all of you cat people in here, good job. That was wonderful. They're just better pets. I don't have to take them outside and it's cold. It's like specifically in Ohio, it's rough to take a dog outside all the time. I like other people's dogs, just not, don't want one for myself. Okay. Harry Potter fans. Yeah. I'll have you all know I'm a proud Slytherin, and that's okay, right? We can all be okay. I can just not without the Muggle hate. Okay, so this one's a little bit more intimate. Nobody who feels uncomfortable answering this has to answer it, but I'm just curious if anybody's willing to. By show of hands, has anybody here ever been to counseling? Wow. Y'all see that? Ooh, I said y'all. That was really, yeah, it was yuck. I'm sorry. How many of you have ever thought about going to counseling? Maybe who have, right? Well, most of you raise your hands for the first one, so there's going to be a lot less for this one. That's pretty freaking cool. Think about this for a second, that we're standing together in a room, in a public space, in a public setting. If I had been having this conversation with all of you maybe 5, 10 years ago, I'll bet we would have had less than half of those many people feel comfortable in raising their hands. That's really amazing that you were all willing to share that. In this in particular, oh, the question, and then there we go, the clicker's working now. This in particular is a microcosm of a larger trend that we're seeing pretty much across the country. Part of what I'm seeing as a therapist is a part of what I'm seeing as a vice president of an organization that does a lot of work with mental health, right? If we look at just this room, and this many of us were willing to acknowledge, I've sought out help. I've been curious about seeking out mental health services. Think about how many folks out in the world are just as comfortable in being willing to do that. And that is amazing. It's amazing because it's a change. Oh dear, we are just flying through that all of a sudden. It's amazing because it is a change. It's a change. What's going on here with clicker? I'm not touching it. No, I wasn't touching it. It was going crazy. That's okay. I'm going to continue to not touch that. It's amazing because it's a change from what we are used to. And that's why it's so important that we're all here together today, is to understand a little bit about how that change in this culture, about how that change in these expectations impact us as leaders, as professionals, and as folks in a workplace that's trying to promote that culture shift in a meaningful way. Okay? So that's what I'm really stoked to talk with you all about today. I have water somewhere, I think. The problem is, it hasn't always been this way. In fact, it's still sometimes not this way. There are still a lot of obstacles in our ways, a lot of myths and misconceptions and the things that are in the lovely title of our program today that prevent us as organizations, as leaders, and as professionals from sometimes taking the steps to create a culture of acceptance and mental health in a workspace. And so I like to start off this conversation by trying to debunk some of those things first and foremost. It went, again, am I switching clickers? Yes, okay. Yes. But we must first do the mandatory data and statistics part of our conversation. This is fun. So you guys are probably familiar with some of this stuff. 2021, national study demonstrated that 76% of people indicated at least one symptom of a mental health condition. That's the United States. Think about that for a second. 76% of humans have indicated that I am struggling with at least one symptom of a mental health problem. Ooh, I'm in front of it. So that's a lot of humans if we just think about the population in the United States. And it doesn't have to be something dramatic. Symptom of depression, I'm sad. A symptom of anxiety, I feel worry. A symptom of grief, I am sad because I lost someone I love or care about, right? So it's not surprising when we really think about it, but it is shocking how big the number is. 84% of folks also indicated that their workplace conditions led to or contributed to their mental health challenges. And that's why that affects all of us here today, right? Because there are a lot of obstacles that organizations have to overcome to work towards not contributing to that problem, which is that many organizations simply don't have either the resources, the awareness, or the energy to be able to prioritize mental health, in a way that allows their employees to feel comfortable and confident in their roles. Furthermore, that changing trend that we just discussed is leading to folks seeking out employers that want to make this stuff a priority, right? 81% of workers indicated that they would be looking for an employer that supports their mental health in the future. These are really staggering numbers, and it's why we're all here together today, is to understand that this is something we have to prioritize. It's not really an option. I get asked a lot, why therapy? Why did I become a therapist, right? And there's a very long story to that, and there's a very short story, and I'll give you the short version. I really genuinely believe that mental health is a fundamental human right. And when we do things in our workspaces, when you find folks do things in your workspaces to help give people access to those services, you're giving people access to that core fundamental human right. And that's why this is so important, right? It's why it really, really matters that we're all doing this together today. So what's in our way? A lot, really. Ooh, I was closer to it. A lot is in our way. I'm going to give you some examples of some things that people say to me throughout my career that I would like to debunk, right? You shouldn't talk about mental health at work. There was a time, probably not that long ago, where that would be a statement somebody has heard or said, where the idea of being quote unquote professional involved keeping a part of who you are, your identity, separate from who you are in your workspace. And unfortunately, that myth and that misconception led to a lot of organizations leaning into this idea that, well, talking about mental health is somehow taboo, right? It's whispered, it's behind the scenes. It's fine to go to a coworker and say, yeah, I was having some health stuff and I went to my doctor and we figured it out, colonoscopy, it's great, right? Like somehow that's not an intimate conversation. But as soon as we bring up like, yeah, I've been struggling with a little bit of depression lately. I don't know, I'm having a hard time. Somehow that's unprofessional or inappropriate, right? And that's been a consistent part of workplace culture for a long time, that being professional means eliminating intimacy in some way. But there's this whole part of our physical health that we've decided somehow isn't. And so I want to debunk that right away, right? It's unacceptable to say that we shouldn't be able to talk about mental health at work, right? Another common misconception: employees who have mental health struggles are going to present themselves as more challenging. And we can all sort of shamefully admit we can think of maybe that person in our minds that we've experienced before, right? Maybe somebody who has a lot of needs or has some chronic absenteeism, is frequently disruptive to their peers or to their coworkers. And because we know maybe they struggle with a mental health condition, we start to broadly generalize that is what somebody who experiences mental health concerns is going to look like and present as. We make the exception to the rule the rule. And in doing so, we do a disservice to people who experience mental health stuff all across the world, right? Because the most extreme presentation of anything is not going to be what we see on an average day-to-day basis, right? And so we have to try to view our employees through the lens, not of somebody who experiences mental health struggles as an obstacle, but rather, how do I look to create a context where this behavior makes sense? And we'll talk more about that phrase here in a little bit. The next one, mental health and physical health should be treated differently. This kind of harkens back to that first bullet point, right? Where we're talking about, so commonly, it's normal to talk about physical health at work. In fact, it's normal to talk about physical health in general, promoting it. Well, it's great. You should, be getting exercise and having a healthy diet. And look, there's these rewards programs we can sign up for where if you do this and do this and do this, you get discounts on your health insurance and all of the lovely things that we do as organizations to promote health. But somehow, as soon as it becomes a mental health topic, we don't do the same thing. That they're separate and they should be treated differently, right? Because they're obviously two different parts of our lives, right? I'm a therapist, right? I talk to people, and most people are experiencing physical symptoms not because they have something chronically wrong with them physically, but because our mental health impacts our physical health, right? These things are intertwined, these things are connected. I'm not a doctor, so I won't get into the whole medical crap, but I will tell you these things are connected, right? And we have to change that perspective. And each and every one of you is a part of that, right? Understanding mental and physical health should not be treated differently. This one's one of my favorites. Seeking counseling means that you have mental illness. So if that was true, we'd have a whole heck of a lot of mental illness in here today, guys, right? That's definitely not the case. The vast majority of people who come to counseling services, the vast majority of people that I sit with each and every day are not experiencing mental illness. If I were to come around the room pick out, let's say 5 of you, and kick you as hard as I could in the shin. I won't, for the record, I won't. I'm not gonna. But if I did, what do you think you'd feel? Pain, right? Pain. And would you think that was abnormal? No. You think, oh, this, well, Daylin's kind of a jerk and he kicked me in the shin, right? That sucks, but like, this is normal. And we're also not going to go to the ER probably, unless I really, really did a number on you, which I don't think I'm that strong. We're probably not going to go to the ER for that. We might rub it, ooh, my shin. And then what happens over time? That pain fades, that pain goes away, but it's also tremendously normal to experience. And that, my friends, is the closest metaphor I can give you to the vast majority of what mental health struggles are. A contextually appropriate response to a challenging thing happening in our lives. Because we all face it each and every day, right? Stress, worry, anxiety, being overwhelmed with the thing that comes next, uncertainty. It's a part of all of our lives. And more often than not, the symptom we're experiencing that causes us to maybe go seek out some counseling is just a normal byproduct of that everyday thing that we all are experiencing. And so going to counseling doesn't have to mean that there's something wrong with you or that there's mental illness. And that is one of the biggest stigmas that we have to try and overcome. Then finally, and I don't know if you guys can see it because of the little translation box, but what that bottom line says is that it's not the organization's responsibility to basically promote, be aware of mental health, to treat mental health, right? So most organizations think that it's their responsibility to do things like offer healthcare, right? You're asking an employee to effectively give what, on average, somewhere between 35 and 40 hours of their lives every week to you. And so the trade-off is that, hey, we're going to give them some things too. But then we decide, well, no, we're only going to give them some things. We're only going to give them access to certain things. That was a dated perspective as well. And we're starting to see organizations change that trend a little bit and come into the idea that we need to support an employee holistically, right? And holistically being all of the different parts of somebody's life. And it's these core myths that lead to the stigma, that lead to people being unwilling to seek counseling, that lead to people being unwilling to ask for help in the workplace, right? It's a big reason why we're all here is because clearly all of you care enough about this to have chosen to spend some time with me on the first day of the conference, by the way. So everybody's feeling, this is day 1, right? Yes, yes, I was not mistaken. Okay, that's exciting because you're all still energized and ready to be here as opposed to on the 3rd day. So thank you guys for giving me this slot instead of day 3. So with that in mind, part of why we bring this up is to highlight that this is important to talk about. Yes, you guys know that. But it's part of each and every one of our jobs to make sure that these things aren't keeping your employees, your staff, your peers, your coworkers from seeking out mental health services, okay? So, little data point that I think is interesting. HR people even realize that our workplace can have a negative impact on our moods, right? In fact, the majority, to both human resource directors, chief human resource officers, and HR folks just working generally, indicate, right? 43%, 35%, somewhat negative impact on your mental health, right? Their jobs. That sucks. US working population compared, pretty similar. So again, the majority of folks in these cases indicate that their workplace has a negative impact on their mental health. Guys, that sucks. That's unacceptable. That's not the world we can be living in. We can be doing better than that, right? Because the place that we're being asked to spend more of our time than sometimes with our families shouldn't be a place that's contributing negatively to our mental health. And that contributes to why we're seeing some of these changing trends. And these trends are changing quickly, by the way. So I would say, and this is more anecdotal than something I'm going to throw stats at you guys for, in the last 3 years post-COVID, I've had more organizations come to me and say, we need to have someone come in and give talks about mental health because we're having our employees ask us more about it, right? We're seeing a generational shift where people are feeling more comfortable in acknowledging that they are having struggles. Think just a few minutes ago when you all raised your hands, I've been to counseling or I would go to counseling. Again, I don't think we would see that a decade ago. And so as an organization, we have to ask ourselves, how do I stay in front of these things, right? There's also been a shift in there's a significant more recognition and acknowledgement, right, of struggles as normal. So if we think back to our little kick in the shin metaphor, right, this really harkens to that. I think that for a long time, and again, anecdotal, but for a long time, folks that would be held back were held back because we all like to wear something that I like to call the mask of expectation. We come into work, we come into home, we come into wherever, and we look across the hall and we see Bob and we say, well, Bob's smiling. Bob is eager to be here. Bob's doing his job. So Bob must be killing it. Bob's fine. He's great, right? And I don't want Bob to see me as not doing great. So even if maybe I've got a lot of stuff going on at home or I've really been struggling and I barely made it on and put on underwear today, right? Like I still have to pretend like I'm okay because Bob's okay. And if Bob's okay, I should. So we wear that mask, we smile, we do the job. But then what we don't know is Bob isn't even wearing underwear. Bob's struggling too because he hasn't done laundry in weeks because he's depressed, right? But the good news is you don't see that. So Bob's putting on his face because he's looking at you and he sees you having your something together, right? And then in doing so, puts on his own mask. When we change that trend, when there's a recognition and an acknowledgement of struggles as normal, suddenly Bob doesn't have to feel ashamed of the fact that he's having a rough day. And in doing so, it takes off that mask a little bit, expresses some genuineness, expresses some openness, and then in turn, gives you permission as well to do the same, right? That recognition, that changing trend has driven more awareness about counseling services than probably any other thing that I've seen in my career. And we also see more people being willing to seek counseling, right? Back in 2004, only around 13% of United States adults would acknowledge going to counseling. That's up now to 26%, according to the American Psychological Association in 2023. Again, that's like, what, 10 years? Less than 10 years? It's a staggering increase. Now, the data can be a little bit deceiving because that's 13% of people who admitted to it back then, right? Versus people now who are more willing to do so. Both numbers are probably higher than it's actually actively reflected in the data, but alas, that's where we're at. And then finally, what even is that last point? Let's find out. Finally, forgive me, guys. Yeah, oh, this one's huge. How did I forget this one? Career is no longer something that is a job that we do for the sake of doing a job. Career is part of our identity, right? There used to be a time and place where going to work was going to work for the sake of earning an income, right? And for some people, that's still true. In fact, a lot of us, that's still true. We go to work not necessarily because we love our jobs, but because it pays the bills. But as more and more folks are entering the workforce, they want their career to be a reflection of their identity. They want their career to be something where they can express themselves. When you first meet somebody for the first time, as we're doing right now, right? I'm meeting all of you, you're meeting all of me. Oftentimes, the first thing we say about ourselves is I'm a whatever, right? The first thing I said to you guys, hi, my name's Daeylin Rock and I'm a therapist, right? We do this. We incorporate our careers into our identity so much that this trend means people want their employers to allow them to express their values. They want their employers to care. They want their employers to give them that platform to express who they are. And this changing trends, my friends, is a big part of why we're all here, because we're saying, how do we make this a priority? How do we do something about this? How do we allow those changing trends to be something that we are reflecting in our values, especially when you guys do the amazing work that you do? It's hard to describe, I think, the impact of somebody being willing to feel comfortable expressing that identity for the first time, that who they are, those moments of being able to come out and say, I feel comfortable in my skin, in expressing who I am, genuineness and authenticity. We talk about a lot in counseling, how to be genuine. And we're seeing more and more people asking for that out of their employers, how to be genuine, right? New expectations. It's true that those trends lead now to new expectations, right? Employees are actually leaving their jobs for mental health. 50% of folks that report leaving a job, at least in part due to their mental health. Think about that for a second, right? Somebody's choosing to say, I don't actually want to work here anymore. I might love my staff. I might love my peers. I might love my actual role, but this job is too much stress-wise. This job is too much for me anxiety-wise. It's promoting uncomfortable things. They're actually leaving, right? And in the EAP world, which is where I am, right, we consistently see that employees are now asking more and wanting more from their employer. It's a reflection of their values, not just a paycheck. They want what they do to be a reflection of who they are. So how do we adapt? How do we keep up? That's the big question, right? That's why we're here. One of the biggest things that we see is from our EAP partners and from our work across mental health is that many employees don't feel comfortable going to their leaders and acknowledging that they're struggling out of fear of retaliation or punishment. So for example, if I am having a hard time completing my work and I go to my boss or I go to HR or I go to somebody and I say that out loud, is there going to be a consequence for that? Because really what I'm saying is, hey, Randy, I don't know why I picked Randy. Usually I go with Bob. Usually nobody's named Bob, so that's a safe one. Somebody might be named Randy. Any Bobs in here, actually? Yeah. Hi, Bob. This is for you, bud. So we don't know what that's going to look like. But we know for a fact, though, that when an organization does, as we're talking about here, creates an environment where somebody's voice is supported, where somebody can come to you and they can say, yeah, my performance is struggling, but you see me as more than just a performance, right? I'm not worried that you're going to punitively punish me because I'm acknowledging that I'm not getting my productivity met, or I'm acknowledging that I'm not getting things done, because the context for that is that I'm struggling with my mental health. That's what has held so many people back. Not just the stigma of, oh gosh, I don't know to acknowledge I'm struggling, but the stigma of, is there going to be support from my human resource team, from my leadership team? And so that's one of the biggest things, right? Creating an environment where you're not going to be punishing folks or seeing them just through a lens of productivity or the work that they're completing, right? Asking yourself, is there a context where this makes sense, right? We have to focus on making mental health a part of workplace culture, right? And we're going to talk more about that. I think you guys have talked about a little bit about that too, in maybe some of your previous sessions today. It's more than just having a benefit that's like an EAP or a wellness program that supports mental health. It's how you guys as leaders interact with employees on a day-to-day basis that's going to help promote that, right? There's also something to be said about identifying organizational trends. So what does that even mean? Let's use an example. For those of you who may or may not know, right, when an organization has like a health insurance plan, right? Oftentimes the health insurance plan gives us data on what kinds of things people are using the health insurance for, right? So let's say they're going in primarily for primary care visits or whatever, right? So if you look at your organizational trend and you see that 2 or 3 of the top 5 reasons people are using their health insurance is for psychiatric medication, that's a trend, right? That tells us something. And then we also see that what they're not doing is not going to counseling. We see them just seeking medication. That tells us, okay, as an organization, what do we need to do to promote the awareness of the benefits that we have for counseling, right? We take the data that's happening within our specific organization, within our specific branch of our organization, and let that speak about where we need to make our focus on mental health. Maybe we see that nobody's using any mental health services. We also take a look at what else is out there in the marketplace. How are other organizations handling this? For example, 30 years ago, you had to convince organizations of the value of even having an EAP or a mental wellness program. Now everybody has one. It's just a matter of who's doing it well. Who has the good ones? Who has the ones where people can get in quickly? Who has the ones where people can seek out services rapidly? And reflecting on that organizational trend gives you an opportunity to ask yourselves, how can we be better, right? But if you're ignoring what's out there, if you're ignoring the trends, if you're ignoring your own organizational data, then you're going to find yourself stuck in stagnation, right? And that's really what holds a lot of organizations back, is we say, well, we've been doing something well for 30 years or 50 years or 40 years or however long. And we let that, I don't want to say arrogance, but arrogance, right, prevent us from coming to what's next, which is a real shift in our perspective in what the employee needs are, and furthermore, not just the need, but the want. The want matters. We can't just think of everything through the lens of need. Spend time actually understanding your available resources. This should be an obvious one, right? But I talk with folks every day who I might ask about some benefit in their platform. You guys have a lot of stuff that you offer usually, and it's really hard to know all of it, right? That's impossible. But try to be aware. And if you're not aware, have resources, right? Know where to direct people. When you're knowledgeable, when you are confident, when you are aware, you're modeling a healthy and successful behavior for your employees. And then furthermore, not just knowing the available resources, but trying to understand what's going to be the best resource for your specific folks, right? For your specific team. Because each organization is unique. We can't look at everybody through a very narrow lens. My wife's an optometrist, And she says, Daeylin, stop doing things like this when you go up there. She's like, that's not how lenses work. Okay. So how do we actually build that culture? That's important, right? That's a big part of why we're here. Culture. I said it goes beyond just having a benefit, right? I'm going to give you guys some tips. Curiosity. This is huge. What does it mean to be curious? Well, you're all showing at least a little bit of it today by choosing to be here with me. You're curious about mental health. You're curious about how to normalize this. So I've said this phrase a couple of times today, creating a context where something makes sense. That at its core is how we lead through curiosity. When somebody brings you something, when somebody is struggling, when somebody is overwhelmed, instead of looking at that behavior through a lens of obstacle, we instead ask ourselves, well, is there a way that this person could have made it to this point that I could relate to or understand? And in doing so, we take a behavior that we might otherwise view as punitive or punishable, punitive, and create a context where that employee can flourish and struggle, right? By asking that open-ended question. But we're scared to be curious, I think, because of those first myths that we talked about earlier. We're scared because we don't want to overstep. What's appropriate? Employees are more than employees, right? They're humans. I know that, again, sounds redundant and sounds sort of like, well, duh. I'm bringing back duh, by the way. I'm a 90s kid, and so like duh was a thing. So you guys should all go out and use it, and then it'll be like, you're welcome. So there's nothing wrong with when you see somebody who's struggling, and that's really what we all are as helpers at our core. Being willing to express that curiosity and ask the open-ended question, not how's your performance, but how are you? How are you? Are you well? Is there anything that I can do for you? Help me understand how we got here. Oh my gosh, I love that phrase. Help me understand how we got here. When you lead with curiosity, you start to promote a culture that promotes mental health, right? Because you're asking an open-ended question and creating a context where somebody's behaviors make sense. Modeling the healthy and successful behavior is essential. Your leaders, people look to us to say, what's right? What should I be doing? What shouldn't I be doing? And when leaders are hesitant to talk about mental health, when leaders are hesitant to acknowledge mental health struggles, when leaders are hesitant, that promotes that that's the normal, that that's what's supposed to be okay. And so when we model the healthy and successful behavior by being willing to talk about mental health, by being willing to acknowledge our own sense of experience of struggle, when we're willing to look at our own behavior through a context that makes sense, and when we're willing to shamelessly and selflessly promote the resources that are available, we get to say, this is what's normal and this is what's okay. Because really, kind of comes back to that mask of expectation piece. If you guys model that it's okay to take off that mask, that it's okay to be genuine and authentic with your employees, more than anything, you're telling them that this is safe, that there is safety in your workspace, that this space is an expression of your values, right? Because that harkens back to that idea. Again, we want to work in a space that's a reflection of our values. We also want to normalize the need for these services. If everybody thinks I'm the only one who's going to use my mental health benefit or my EAP or go to counseling or get help through the insurance, right? If I think I'm the only one who's doing that, chances are I'm not going to do it. If I don't know that the thing that I'm experiencing is not some type of catastrophic thing that I'm going to lose my job over, I'm probably not going to do it. And so when we have conversations like this, we help normalize that experience of suffering. And that sounds sort of morbid, right? Like normalizing an experience of suffering, but that's truly what we're here to do. Because each of us will suffer at some point, and each of us will experience the contextually appropriate feelings of depression, anxiety, and worry, and hopefully not schizophrenia. If you're hearing voices, come talk to me after, right? It'll be fine. But normalizing that. And then finally, being able and willing to know and promote the available resources. That's the second time this has come up, which means it's important. Do you guys know your benefits? You know your mental health benefits? Yeah? Would you be able to explain your mental health benefits to a lovely person who came up and asked you about them? Do you? Yes? I hope so. Because it's okay. And when you do that, when you do these four things, when you learn to lead through curiosity, when you model the healthy and successful behavior of promoting and normalizing mental health, and when you are fully aware of and advocate for, not just know of, advocate for, fiercely advocate for the utilization of those mental health resources, you teach and show through that modeling that this is okay. And that culture begins to permeate itself throughout an organization because it starts with leaders. It starts with human resources. It starts with senior executives. It starts with leadership because you guys are the ones that people are looking to tell them what's okay. And if we're hesitant, if we're shy, if we're not curious, then everybody else is going to continue to wear that mask of expectation. And we don't want that. At least I don't want that. I don't know about you guys. Maybe you do want that. I would like to think that by virtue of you all being here, you're not. There's a pretty cool guide out there that I like. In 2021, the Surgeon General thought this was so important, as I do. Ooh, it gets loud, sorry. That this was so important that they put out a guide on a framework for mental health and well-being in the workplace. And there's a link to it. You can't really see it at the bottom there, but if you guys get, I think, an electronic version of this presentation that should be clickable, I would hope, check it out. It's really cool. It's a really long document, so if you're not an avid reader, wouldn't recommend, which is why I put some key bullet points on here, which we're going to talk about. But it really, really highlights the priority of learning to make mental well-being and mental health in a workplace so important, so much that they did an entire study on it. So the key things that came away from this report was these 5 areas, right? 5 essentials for workplace mental health. First is protection from harm. What does that come down to? Safety, psychological safety, feeling like in my workspace, I can be genuine, I can be authentic, I can be myself. When you promote protection from harm by people feeling comfortable and advocating for themselves, back to that first point that we made a little bit ago about how if somebody's afraid of punishment for acknowledging their struggle, that doesn't sound safe. Number 2, connection and community. If you force people to operate in isolation, we feel sad. I feel sad if I'm alone all the time, which is why I have my cats. Cats are great companions, and wife, but cats. When we operate in a vacuum, we're unhappy, right? So we've seen that consistently. When people feel connected and there's a sense of community in their workspace, they feel mentally better. They feel more connected to their work. Work-life harmony. That's sort of a spin on work-life balance. We like harmony better, I guess, is the phrasing that they've chosen for whatever reason. But really what that comes down to is there's a real trend away from all the work that we have to do, right? 40-hour weeks are sort of starting to go away a little bit. We're seeing more hybrid models, working from home, people doing 35-hour weeks. And so really we see when you create, like, think of that as flexibility, right? When you promote flexibility, when you encourage folks to have balance between who they are in their work and who they are in their identity outside of work, we tend to see a little bit more, I shouldn't say a little bit, a lot more comfort in expressing their mental health and tend to feel healthier and more well. Mattering at work is huge. So if we think back to meaning, there's a whole like existential session we could do, which would be like 2 hours long, which would be great. It would be very boring for most of you, but I could talk about it forever. Is sort of man's search for meaning. Like, how do we feel connected to both our identities and the things that we're doing? And if we think back to a few minutes ago when I talked about our careers being an expression of our identity, that's really what this means. And it's really important. How do you make people feel like the work that they're doing matters? Sometimes that's praise, sometimes that's validation, sometimes that's curiosity, right? Where are somebody's strengths? And how do I leverage somebody's strengths in a way that allows them to feel connected to their work? Strengths-based approaches in the workplace is, and again, a whole nother topic we could have. And then finally, opportunities for growth. If people feel stagnant and stuck, we tend to feel sad, right? Again, it sort of goes without saying, but I'm sure some of you have felt this way before in your careers, or if not in your careers, in your personal lives. When we feel like we're not excited about what comes next, we tend to feel sad. We feel low, we feel hopeless, we feel helpless. And hopelessness and helplessness drive mental health conditions. And that's not what we want to see. So if you're curious to learn more about this guide, please check it out. It's really, really cool. I like it a lot. The data supports that when we do these things that we've talked about today, the results speak for themselves. Those who feel supported by their employer end up half as likely to report symptoms lasting longer than 5 to 12 months. And that's one of the things that we want to see. We want to see people not experience chronic mental health conditions over a period of time. They're also much more likely to feel comfortable coming to your team, right? To leaders within an organization and saying that they're struggling when they feel supported by you, which in turn leads to them being more willing to stay with you. And that's really what we want, right? We want folks to feel empowered to be supported by their employer so that they'll stay with you. You want people to stay. People are a resource. They're our biggest resource, is helping people feel comfortable. And when you invest in them, they will invest in you. When you have a really, really robust mental health platform, like a good EAP, we also see folks improving employee satisfaction, much fewer turnover, and a reduction in overall insurance utilization. Because guess what they're not having to do? They don't have to go and use their health insurance and pay an $80 copay to seek out mental health services if you have a good EAP. And most organizations check that box. They have an EAP, but very few of them have a good one that actually gets people in quickly. Would anybody like to guess what the average wait time to see a therapist in the United States is? 4 to 6 weeks. That's average. In Ohio in particular, 6 to 8. It's a long time to wait to see a therapist when you need help. If you guys have good EAP, you don't have to do that. EAPs get people in within a week or so. So it's really important to make sure that you're investing in the things that will promote wellness beyond just all of the wonderful things that you guys are going to do following this session. I'm going to be aware of time because we started a little bit late. So in closing, I loved getting to talk to you guys today. I'm so stoked that we got to be together. Please remember, if nothing else from this conversation, create a context where employees' feelings make sense, right? Be kind, lead with that kindness, and more than anything, be curious. Anybody have any questions? Thank you. I'm happy to answer anything that anybody has. Anybody want to know anything about anything? Cats. I can talk about cats a lot too.
So what's the number one reason somebody seeks EAP assistance for a mental health need?
So it's a great question. I would say that varies based on the population. So most recently, we've seen a much higher trend towards depression. And that came after COVID and after the pandemic, and also folks seeking out support for what we're calling sort of chronic anxiety about uncertainty. So there's been a lot of unpredictability in the world the last few years, and that leads to real challenges. But so depression, anxiety have been the biggest two. Yes, over here.
That staff person who seems to always be in constant crisis.
So the question was, for leaders, what advice can you give as a therapist for how to handle the person who always seems to come to you in constant crisis? That is a great question. We could have a whole counseling session on that one, trust me. The short version of what is a pretty long answer is this. So when that person comes to you and is constantly struggling, is the lens that we view them through that they have a mental health condition? Or that they want to make your job harder?
Mental health.
Yeah, we'd like it to be that, right? We want it to be that they have a mental health condition. So that's really comes back to that curiosity thing again, right? More often than not, that person is struggling with something that may be a diagnosable mental health condition, and they might not be getting help for it in a meaningful way. More often than not, the person who's creating struggles in the workplace is probably not in treatment. And so that's where being willing to ask the really hard question of, help me understand how we got to this point. Are you accessing any resources currently that can help support you through this challenging time in your life? And then there's a phrase I like a lot which is empathy is the engine of connection, right? No matter how agitating that particular employee can be, when we lead with empathy and kindness, they're much more likely to view you as an ally instead of an obstacle, right? And when they view you as an ally, they're much more likely to open up about whatever struggles they're experiencing that you can then help get them connected to a resource. Your EAP, your mental health platform, whatever you currently have. And doing so usually can result in a reduction in the percentage of disruptive behaviors. Great question. Other questions? No? Okay. I'll be around if anybody wants to chat with me. Thank you, guys.
Thank you, Daeylin.